we're virtual this year, so thanks for joining us. This is our first session today, and it's on using smart city technology to fight the COVID-19 pandemic. This is something that we've been writing about almost since the pandemic started here at ARC. Obviously, there's a lot of ways we can use technology to fight COVID-19 within the city environment, or the built environment, or the work environment. And we're going to talk about some really good use cases today. We have some excellent presenters here. Some of them have joined us from halfway across the world, and we certainly appreciate their participation due to the time difference and everything. But I think this is one of the good things about these virtual forums, is that it doesn't matter where you are in the world, you can still participate, as long as you have the fortitude to stay up late. If that is the case. So we have some great examples of how we're using technology to combat COVID-19 today, and I don't want to take up too much more time. I'd like to introduce our panelists and presenters this morning. So first up today, we have Namrata Somani. Namrata's branch head of Tata Consultancy Services, or TCS, in Ahmedabad. I hope I'm pronouncing that correctly. She's joining us from Gujarat today, in India. Namrata is responsible for TCS operations in Gujarat. TCS is the largest IT service provider in Gujarat, and she is also a program director for Procurement 4.0, an initiative under the TCS CIO to transform the procurement technologies utilized in TCS. In her 26 years of professional experience, she has been instrumental in making her customers successful by unleashing the value of IT for their business. Her career experience covers working with clients in several industries, including banking and process manufacturing, and pharmaceutical and energy and resources and utilities and ports, and the list goes on. Our next presenter is going to be Jarmo Suomisto. Hello, good morning, or good evening, Jarmo, I should say. He's joining us from the city of Helsinki today. Jarmo is the project manager for Helsinki 3D Plus. He's going to be talking a little bit more about that in his presentation, and he is responsible for creating, maintaining, and delivering virtual models over the entire city of Helsinki. 3D Plus also integrates new technology and workflows to processes and city services. And 3D Plus is a 2020 and 2016 Year in Infrastructure Award winner, and the 2019 London Tech Fest Main Award winner. And he has over 25 years of experience with 3D and GIS in building design and city planning. And up after Jarmo, we actually have a last minute replacement today, and I really appreciate that, Endrit. Our original presenter was Brian Lane of the Center for Health Affairs in Cleveland, but as you may have read in the news, that area is experiencing some pretty significant weather issues right now, so Brian couldn't join us. And Endrit has graciously agreed to fill in for Brian, and they have an excellent presentation as well. Endrit's an MA in economics, and he's the director of data management of the Center for Health Affairs and its business affiliates, the Champs Group Purchasing and Champs Oncology, that's CHAMPS, and the Essentials Group. Meta transforms data from in-depth analyses into actionable data to help achieve continued growth. He's an accomplished project analytics consultant and currently leads the center's data initiatives, which are primarily focused on the creation of a regional data hub. They are aiming to transform the way data is shared across Northeast Ohio. Meta provides a bridge to connect the healthcare community with the region's stakeholders to influence care transformation beyond the hospital walls. And we also have a couple of vendor participants with us today that are, in conjunction with our end users. First up, we have Tom Vries, who is Senior Director of Business Development for Digital Cities at Bentley Systems. Morning, Tom. Tom has more than 25 years of experience in the utility and government solutions business. During his 13 years with Bentley, he has been responsible for Bentley utility and government success in the Netherlands, Germany, and Eastern Europe as sales director for these regions. Now, Tom is relocated to Exton, Pennsylvania, and leading Bentley's 3D City Initiative as a solution executive for government. More recently, Tom was responsible for the global water and wastewater modeling sales team and business development for utilities, in close coordination with Siemens Energy Management. Today, he's a senior business director of development for digital cities and responsible for Bentley's go-to-market strategy for digital cities. And last but not least, we have Robert Hylton. Robert is co-founder and COO of a company called Transpara, and they're doing some very interesting things, and we'll hear more about that. Robert is a technology industry entrepreneur and executive with over 25 years of experience in the software industry. Transpara is the third company with the same management team, including one that was sold to Rockwell and the other to OSI Soft. And additionally, Robert spent 10 years at Microsoft, leading global product marketing and sales teams. And at Transpara, he's responsible for all sales, marketing, and commercial activities, in addition to his active role in the user experience design of the software. So again, good morning or good afternoon or good evening to everybody. We really appreciate you being here. I would like to start by just diving into our first presentation. So the way we are going to do this is we have 3 20-minute presentations from our end users, and then we're going to go into a half hour or so panel discussion where we are going to take questions from the audience. I would ask you to enter your questions into the Q&A window, which is found at the bottom of your screen. And we'll be looking at those questions and trying to answer them as we do the panel discussion. We also have a chat function, which the attendees and participants are welcome to use. But for the questions for the panel, we are going to be looking at that Q&A box. So I would ask everybody to please, enter their questions into that Q&A box. So without further ado, I'd like to jump into our first presentation. So I'd ask all our other participants, except for Namrata, to go off video right now. And we will dive right into Namrata's presentation. So let's all give Namrata a warm welcome. I'd ask everybody to applaud, but I don't think that's possible at this point. So thanks for joining us, Namrata.
Yeah, thank you, Larry. I'll just get my presentation up. Larry, is this visible?
Yeah, we can see you just fine.
Great, thanks. So thanks ARC and thanks Tata Consultancy Services for giving me an opportunity to present to you how we have used one of our own internal solutions for Smart City to build a workplace resilience when we look at returning to work while the pandemic is still going on. So brief about my company. Tata Consultancy Services is a global IT services consulting and a business solutions leader. We offer consulting services, consulting-led and cognitive-powered integrated portfolio of business technology and engineering services and solutions. We've been partnering with some of the large global customers into their IT transformation, digital transformation journeys. We service we operate at 187 solution centers located in 19 countries. We have almost 450,000 employees, talented employees, located in 46 countries. We use significantly a methodology which is unique to us, which is called a location independent agile methodology to deliver transformation programs to our customers. We are the third largest IT services firm with a market cap close to $90 billion. And we are rated as top employers across many countries globally. When the pandemic hit us, we looked inwards and we looked at our own smart city solution, which is called TCS Intelligent Urban Exchange. This solution helps connected cities to create a world-class experience, a unique experience, a personalized and individualized experience for a city, for its citizens, as well as it enables workplaces to become smart and safer. The Intelligent Urban Exchange solution is developed by our Digital Software and Solutions unit. It is a strategic business unit within TCS and it partners with its customers on a digital transformation journey. It uses advanced analytics and innovative approaches to deliver the same. So when the pandemic started in the early part of last year, our first focus was to ensure the well-being of our employees as well as ensure business continuity of our customers' operations. So we immediately responded with a workplace model called secured borderless workplace solution, We moved all our workforce to work from home using this model. But we were sure we needed few people in our office, not only to run our essential services, but also to carry out client-sensitive tasks from our secured offices. We also knew as the pandemic would slow down, we will need more and more people to come to office. So what were the three key asks that business had from us? One is identify people who are at low risk and bring them to work whenever the opportunity provides us to do so. While we bring people to work, we knew that the COVID is an unknown disease. We will be seeing many surprises around it. And foremost of importance is it is spreading through a human chain. So how do we ensure that we mitigate the risk of spreading the solution within the office premises? Uh, Looking at the unknownness, we also knew there will be a lot of government regulatory requirements that we will have to continuously be fulfilling. So we just needed something by which we could create a safe workplace in the new normal. To identify what we should be doing, we looked at our TCS framework, which we call Business 4.0 framework. We use this framework for our own internal digital transformation as well as transformation for our customers. The first and foremost need of the hour was to embrace the risk of COVID. And while we embrace the risk of COVID, this was a bit different than embracing any of the other risks which we had understood so far. Most of the other risks that we had planned for earlier looked at city level risk. We never had to need to look at an employee level risk, but here we were wanted to embrace a risk where we had to look risk at an each and every employee. So that means we had to look at a solution that would enable us mass personalization. We also knew that whatever we do, we need to be quick. We need to look at just Wix and get going with it. And hence we, as people who head the operations of several centers in TCS, we searched for solutions within our ecosystem. And IUX was one such solution that really fit the bill properly. We looked at a cloud-based deployment so that we can get going in a couple of weeks, and so did we. Almost in 4 weeks, we started with the solution. We also knew that this is not a solution which can have a large bunch of requirements and then we look at it. We will have to look at Agile as an approach. We will have to look at Agile to release incremental business value. Today, as we talk, we are in the 13th sprint of releasing incremental business value. Uh, I talked about having 450,000 employees that we employ across 187 delivery locations. So for the decision makers to do any decision, we needed a solution which was intelligent, which would give us enough dashboards, rich visualization to take our decisions of operating a center. We also knew that something like this, analyzing risk at an individual level, would need a lot of automation. What we typically call is, if the machine can do it first, let it do. Let's not human being do it. So we looked at analytics and combining it with automated processes, giving a lot of intelligence. We embarked on looking at deploying the IUX solution in TCS. So what were the key areas of functionalities that we have deployed so far? The first and the foremost need was to have risk analytics at an employee level. This should look at both dimensions, the location risk, because COVID was behaving very differently in different regions. Some regions were high up on the peak, some were low, some started peak later. Then we went down, there were second waves and so on and so forth. So the geospatial information was very critical, coupled with employee related health aspects. Uh, Having done an analysis, we were equipped then to understand who are the people we should be bringing to the facility. We would look at a 7-day, 14-day, 21-day prediction to determine whom all we can bring to work. But we need to keep a close eye on a daily basis because maybe the location from which associates are coming, that has just seen an outbreak and we may want to just stop them from coming to work to bring it, to spread it further in the offices. The next thing we looked at was if we have such a large workforce, and in pre-COVID era, we used to have 7 to 8 million footfalls or swipe records into our access management systems. How would we be equipped to do fast contact tracing? So in case we found that somebody had come to work and has later turned COVID positive, how do we quickly do a contact tracing, identify other people who could be primary contact, who could be at risk, and isolate them? So we build a strong contact tracing engine, which has a lot of artificial intelligence built into it. It looks at access records. It looks at transport trips. Pre-COVID, we had something like 20,000 transport tips per day. This could be cabs or it could be buses. So it would look at various sources of data and do it. While we look at bringing people to work, doing contact tracing, what we felt is the best weapon here would be ensuring sufficient social distancing is being followed by people while they are at work. So we looked at two more solutions. One was looking at an advanced video image based analytics solution that can give us alerts saying, okay, this part of the facility is saying congregation, and we can disperse that congregation if any. And we also looked at a mobile-based Bluetooth-enabled application, which would help do proximity detection. So it worked in helping create a culture of social distancing within the organization by employees getting an alert whether they are within close proximity. And also when we were running contact tracing jobs, we could get results from proximity to zero on the high risk individuals and isolate them. Of course, besides this, there were some basic requirements of compliance management, temperature screening, and record, and so on and so forth. Uh, I'll just give you a flavor of how the application looks by sharing some of the screenshots with you. So what you see here on the right is a RISCO grid. This gives us a projection of associates that have been identified or who can be identified to come to work. It's like the daily risk score, a 7-day projection, a 14-day projection, and a 20-day, 1-day projection, by which we would actually select the section of employees who are at low risk and also understand the business need of getting them. Once we have approved for them to come, we had this daily risk monitoring profile by which we can understand of the people whom we have selected to come who are reporting to work, what is the risk profile and do we need to do a course correction so that the risk within office is contained. Um, both these actually needed a lot of geospatial analysis, and this is a representation of a city with a lot of hotspots and where the employees are residing, which would fit in into our risk model. This is a representation of our contact tracing jobs. So once we run the contact tracing jobs, the system would tell us where the contacts were. The system would classify the risk level of those contracts, the confidence level of the contact tracing. So maybe after looking at several data sources, we were able to quickly zero on the primary ones that should be isolated. The other two is when I talked about social distancing and creating a culture around social distancing. So this is our video-based congregation alert system, which looks at where the people are and whether they are within 2 meters of proximity and what's the dwell time for that proximity, and then create alerts. So this helps us manage common spaces like entries, exits, cafeterias, and so on and so forth. And this is a representation of the mobile-based proximity detection app that we have, wherein it would give individuals an alert saying you are within proximity and you're requested to maintain social distancing, besides helping us in contact tracing. So this is how our product looks like. Currently, we have enabled the product to be working and is operating for 120 plus locations across the globe. We are doing daily risk profiling of 180,000 employees. Current footfall of employees coming to office generates around 700,000 daily swipe records. So in case of a contact tracing, we are able to shift through these records and within 15-20 minutes give out the results of the people who are supposed to be quarantined. Uh, we get information about from 6,000 containment zones about the COVID infection that's happening there. And since the launch that we have had, we had the unfortunate need to run through the 300 plus contact tracing events. Of course, these were not necessarily COVID positive. We are running for suspect cases as well as positive cases. It did help us save efforts of doing contact tracing, but more important was it helped us prevent risk from being spread further, the infection from being spread further into the offices. So it in fact helped us save 5% more people from turning COVID positive, which helps a lot because employees currently are really, really worried about coming to office, and they think if office can be a place from where infections can be acquired. So this really gives us a confidence for looking at it very critically, building the culture that is needed. And then in the need, there is a contact tracing need. We also know to quarantine and prevent further spread within the facilities. So what ticked well with our program, or what did we learn during this journey? One is, as I mentioned, Agile was a methodology that we used. Uh, every few weeks, we would release new features, new functionality that would enhance our capabilities to manage this risk very well. When we started working on this, and I believe any smart city solution which would look at individuals, data privacy becomes very critical. So I talked about assessing risk at an individual level, and hence there's a lot of PII data that we need for an individual to be processed. How do we address data privacy? We are a GDPR compliant organization. All our IT systems are structured to handle data privacy. So we had a quick win there. We started leveraging data from the sources which we had internally, but the purpose of those sources were very different. So when I talk about access card, or when I talk about video analytics, yes, we did have those systems already in the company, but they were only meant there to do security incidents, physical security incidents investigation. And here we are now going to utilize that whole set of data to do more analytics around it. And analytics is as good as the information that you feed into. So getting the right metadata around the source data that we had became very critical to the program. What we also discovered is the moment we integrated one source of data with the thought process of a particular use case, we started getting demands for more and more use cases to be developed using the same source of data. So again, going back using our agile methodologies, we were able to incrementally release a lot of business value. Also, when we talked about doing analytics, doing prediction, finally, the output of which had to be utilized by our HR professionals to make a decision, by our operations heads to make a decision as to what set of people have to be allowed or invited to come to office. And hence, the output of the risk engine had to be very simple, intuitive, and easy to understand, and easy to make a decision around. So, this was some of the things that happened were there in for us, or we learned along the way and we tweaked what we were doing. Uh, this solution also got the IoT Breakthrough Award 2021. And those who are interested in knowing more about it, it's already there on our website. The links are available here. So with that, I would like to thank you for giving me this opportunity to present this solution to you all.
Well, thank you very much, Namrata. That was a very interesting presentation, and I think an excellent example of how you can actually use a smart city platform to manage what's happening with COVID and getting data from all these different sources and trying to place it into a common context. We'll be asking you more about that later. So thank you again. And right now, I would like to pass the baton over to our next presenter, Jarmo Suomisto from the city of Helsinki, Finland. And Jarmo, I won't take any more of your time. Please take it away.
Okay, thank you. Thank you, Larry. Yes, and greetings from snowy, rather cold Helsinki. We have now real winter, which is very fine. And so, yes, my topic is city models. I'm a city model professional and enthusiastic of city models. But I'm also a city servant, and cities are, of course, they are for the people, and cities are very practical, and cities use technology and innovations to create good and happy life for the people and in a sustainable environment. So that's the goal. And as a city servant, of course, I look technology from the practical view. Scientific view is very nice, but I must be practical as a city servant. But nothing wrong with that. And as a former city planning architect, I'm certainly interested in using new digital tools in creating more lovely and functional cities. I'm working in the Helsinki Mayor's office in the strategies division in the data and analytics team. We have there a 3-person small sub-team of 3D creation. So this is our 3D team. And together, our small team has almost 70 years of experience of working with 3D. And what have we learned during those 70 years? So we are very realistic with city models. for us, 3D is far beyond eye candy and virtual fun and pretty pictures for the mayor. So it's a real tool for us, and we also understand it demands a lot to get benefits from the city models. But a little bit history. So 1985, it was like this, and this was super cool. Hidden line renderings, what a wonderful thing. And the first real city model we had in Helsinki it was 2002. It was LOD1, created with MicroStation CAD software. And the first use case was showing the new master plan as a texture on terrain model. So I made this image in 2002, so 20 years ago. It was like this. And so this is the image of our latest project. So last year we are at this point. A lot of development is done and happened in the last 35 years. But I think still city digital twins are in early stages of use case development. I think the situation is about the same that we had with internet in the 1990s, and we all know what the internet is now. The same grand progress can be reasonably expected with urban digital twins, and I think this 2020 decade is the obvious breakthrough era. So we have so much advanced technology, we have 5G, we have so much software game engine development, so it's a broad development, and I think the breakthrough is now very, very near. Yes, about the concepts, it all begins with the data. The availability of the data is the fuel of I think everything, and the data quality and the lack of the quality determines a lot of the outcome we get from the data. Helsinki wants its urban data to be as open as possible, and good quality, secure and open, accessible, versatile data means usable data. And we have 4 main goals in our data strategy. I don't read these through. You get slides if you want afterwards, and you can read those, but there are 4 main points. And of course, there's the city as a platform as the last one, and city models as a platform. The digital twin platform, doing digitally first is something very important for us. Then a little bit about 3D models. There are several types of city models. There are CAD models, there are semantic models, there are point cloud models, there are reality models, there are game engine models, and also hybrids of previous. So each type of city models is functional for special use cases. And of course, enriching the 3D model with other data sets and object attributes is one of the key features of digital twin model. And then, yes, in Helsinki, we have 2 city model production lines. Both models cover the whole city and also the 300 coastal islands. So we have the reality model production line, whole city, and city GML model, and both are open data. And we see that reality model and city GML model are not against each other. So I think we need both of these, because it's both, and we get benefits from both of those, and we want the benefits from both models. And at this point, we keep on doing this, and we have the 2 production lines going on, and maintenance lines also. And yes, what's the difference? The difference of visual appearance is not big. So you see the reality model on the left side, it looks a little bit better than the semantic model. The texture is better, and the shapes of the buildings are better. So in a visual, let's say, competition, the reality model wins this thing. But then if we look at the situation behind the textures, so reality model is made of, it's a polygon mesh, and semantic model is a model with the data structure, so the vertical, the shape structure, and the semantics in the database. So it's more scientific, but also the use of CityGML, getting benefits from CityGML model is not easy. I say it's quite difficult. So at this point, it needs quite a lot to get, and it's rather complicated, although the potential is great. And as an open data reality model is far more popular than CityGML, because of course these reasons, and of course for the visual reasons. Then yes, the digital twin. So digital twin is very much a way of thinking and acting. So combining urban data models to processes and services is the way of doing digitally first. And getting added value of models and interaction between real world and digital worlds is the digital twin way. So interaction between the real world and the digital world. In Rotterdam, which is a very good cooperation city with us, they have the real world, they have the digital world, and they combine there the social world, the third factor there, and they are building that entity. I think that's super interesting, and I think something about the future. So, but we are not so far in that sector, let's say it like that. But yes, about the digital leap and the change to digital world and using digital twins, and yes, at least in cities, the 25% of the digital twin works and the digital leap is technology, and 75% is the cultural and social change. So doing only the technical thing, you get hardly anything. So the big work is with the cultural things. But of course, without the technical part, you can't make change in the social thing. So so it is. And the same thing, same figures in a different way. So having the technical core is the beginning of the bigger change. And has this fact been taken into account when shaping the organizations for digitalization? So I'm not sure. In city of Helsinki, I think it's 50-50. So technical stuff is as big as the social and cultural change in people. So people who are chasing the quality systems and modeling the processes and doing like that. So more and more effort should be put on social parts also to get real good results. Helsinki Energy and Climate Atlas is our flagship service to build understanding what is needed to be carbon neutral city by 2035. This is built on a semantic city model, and the service works technically fine on all devices, all smartphones, tablets, and everything. But the ways of getting benefits of the service models takes time and effort. So this is not an easy tool to build, but we are building the understanding of reaching the goal like this. And then a little bit about open data and open co-innovation. Open data and open standards enable many-sided co-innovation. Projects with universities are valuable for both cities and universities. Also, hackathons and developer meetings are part of our active open data policy. So it's not enough to just deliver the data and say we have it there in the service, just get the data. You must be active and encourage developers to use that and arrange happenings around the open data to get the benefit on that. But of course, it's worth of doing. One fine example of our open data is the cooperation with the Helsinki heat demand prediction. So this is a cooperation project with the Technical University of Stuttgart, where we had a thesis work and we created together a service, what is needed to reduce the carbon emissions of building heating 80% to reach the carbon neutrality. It takes considers only also the climate change, and it has also the modules for what's the effect of building renovation to the carbon emissions and so this is a simulation of renovation acts and action needed to reduce the CO2 emissions, and I think this is one of the most advanced simulations to reach the carbon neutrality in heating way. Yep. And then the strategic goals and the smart city. So yes, we can support the city strategy with digital twins. Smart city goals are widely shared, and digital twins are one essential part of operating system behind smart city. And let's see, Helsinki city strategy, it ends this year, but we have a goal to be most functional city in the world. That's ambitious enough. And when I studied the Helsinki strategy, I found the 129 goals that we can support with city models. And I showed this to our mayor and said, you can ask whatever number and we can explain what to do. And so we choose the Helsinki Energy and Climate Atlas to reach the carbon neutrality in 2035, to be the most important and to support that. And we have been working very hard with that goal. And yes, those who are more interested of our work, we have an open report of the Kalasatama Digital Twins project. It explains how we create the models, how it's about the use cases, and so it's free, downloadable from our website, and you get the links in the end of my presentation. And yes, and in the end, I have a video clip of our services. So 22 years ago, it was like this, all manual thing, but this is our first simulator, manual work. And this is our semantic city model, 80,000 buildings, 1 million semantic surfaces in the databases, and endless possibilities to enrich the data. This is our reality model, entire city 2017, entire city in this accuracy. I think it's wonderful, and it's very popular as open data. And yes, we can do what if analysis. So we raised the sea level 10 meters, it's enough, but to show what can happen and show people and bring the understanding, and you must do something and act actively to avoid this. This is, of course, terrible thing. Although our mayor said that it looks so pretty with water. Helsinki is a wonderful city. So that's positive thinking. Okay, like this. And then Helsinki city models are also streamed to Unity game engine developers. It's a company called Umbra. It was a Finnish company, but Amazon bought whole the company a few weeks ago. So now it's a US company owned by Amazon. It was so successful, and they have wonderful service, and so they are very forward looking. So this is not the Finnish company, but nevertheless, they are doing wonderful work. And then working with Unity and the streamline. So this is a urban lighting design for Finnish company. They use the Unity platform there, and they are planning the street lights there. So this kind of work can be done in a day or two, not a month or two, because you have all the background ready and so. And this is something very special. So this is a city model, 100-year city plan over Helsinki, and we made in our office this this model from that, so the computer doesn't know that this is a scale model, it is in the real world coordinates. Also, several projects can be shown and produced and built the understanding on different platforms. Here we use the Bentley City Planner Online, which works very well. It's very easy to do. I made this demonstration over the huge traffic plan in one day on the City Planner platform. And this is a little bit more about our energy and climate atlas. So it has lots of attribute data, renovation, building years, whatever you have in the Helsinki 80,000 buildings. And it has also what's the heating method over the buildings, what are the renovations done there, and so. And you see the situation, it's very colorful in the small house areas, and even there are black buildings which are still heated by coal, which is not very reasonable. Yes, and one wonderful thing we have the solar potential service. So 80,000 buildings, 1 million surfaces, and each of these 1 million surfaces has a own diagram and value of solar radiation and the potential and how much you can get solar energy from those surfaces. And you see the texture there, it shows that the warmer the color, the more you get energy there, and it also calculates the shadow effect of nearby buildings there, and if there's a shadow, so you get less. And it covers also the facades. Of course, you can subtract the windows there. And more with the City Planner Online, though this is the Kalasatama area and portal. So it's a communication portal also, telling people what to do, and of course these all work with your smartphone and every device. So very easy to use and very practical, and such a wonderful feedback we get those. And then high-rise buildings are rather new things in Helsinki, and of course the wind is very cold in the winter, and wind is not good for us, and with such advanced wind flow analysis, what's the wind conditions between the buildings on the street level are very useful, and now we can do this by computer. So like in the car industry, so no more wind tunnel work and things like that. They are super fine. And in the last things, yes, we have cooperation project with universities, also in Aalto University, Helsinki, and we are working together to create more automated processes. This is a city model made by drone flight, 6K drone, and then there's calculated the mesh model there and run with Unreal Engine. And I think it looks rather good, and I think this is the future of the city model, so it can be in a few years like this. And here are the links you get there, and thank you. This was my part.
Thank you very much, Jarmo. One of the things we've been writing about in the midst of this pandemic is that we have a lot of empty office buildings, and a lot of owner operators and end users aren't really taking advantage of the energy savings opportunities that exist right now with so many people being out of the office. So I imagine I'll have some questions like that for you, and maybe some other questions on, how you might be using this model to manage public health data and so forth, because I imagine there's a lot of information you can get out of there too, and very detailed, very impressive models there. As sort of a part-time video game player, I'm pretty impressed with that. So we're going to pass the baton over to Endrit Mehta now. Good morning, Endra. Or good afternoon, and we'll just let you start your presentation, and then after that we'll dive right into our panel discussion. So please, let's welcome Endrit Mehta.
Thank you, Larry. Hello, everyone. And my name is Endrit Mehta, and I represent the Center for Health Affairs. We're the Northeast Ohio Hospital Association. So I'm going to tie in a little bit of what the COVID pandemic, the needs everyone has heard of, it put on the community in the healthcare sense, and then tie that into the community at a greater viewpoint. Because one of the things you hear me probably say again during this presentation is 90% of our healthcare as individuals happens beyond the hospital walls. So all of the work going together, such as the smart cities technology and combining everything, this is stuff that was already pre-happening, and there was a need way before COVID. It was a catalyst. It increased that speed of it, and it increased our responsibilities to respond to it and bring our solutions forward at a much faster pace. But the other thing with that is, because the needs were before COVID, all of our solutions that we're all doing in our little silos and then bringing them in together will be needed beyond COVID, because there will be a time that COVID would not be the all-encompassing subject of the day of our lives anymore. So everything that we're building is all setting the foundations for the next steps as well. So there's a little bit about me. I'll just go past that. So the Center for Health Affairs, as I mentioned, is the Northeast Ohio Hospital Association. And COVID actually brought us full circle, because we're a 100-plus-year-old organization. We started out in 1914. And for Northeast Ohio, we actually were one of the leaders in our area's response to the 1918 flu pandemic. So this is not our first time as an organization working in this type of social challenges and trying to get the best solution possible. And that has to do with our core, where we want to be able to convene all the community partners and see what possible innovative solutions we can bring in to our community and beyond. And we always, of course, tie in our healthcare aspect of it, but we know that healthcare is only one portion of our daily lives. So we want to make sure that all of our solutions and our partners come in together to get something that it starts out in Northeast Ohio, but hopefully go beyond, that it helps communities grow together and solve issues together. As I mentioned, we're an organization that started out in 1914. So we've been around for over 100 years. And in fact, we were the first metropolitan hospital association in the United States. We represent 36 member hospitals around in Northeast Ohio. There are direct hospital members. However, we have a national reach, because I will go through in a little bit, is we have a group purchasing organization and an oncology program where almost half of our employees are across the nation. We have employees all across the United States. So being virtual was actually something that was one of the things for us. It was March 14th, I believe the Friday or 12th last year. They told us, hey, we're all going virtual. It was an easy, just pick up your laptop and go, because we already had everything preset for ourselves, because we had the experience ready to go. But we've noticed that a lot of our other partners had to grow in that area very quickly. So as an organization, we represent over 17,000 GPO members in the United States, and we have over 67 oncology clients around in over 10 states. Real quick about our member hospitals in Northeast Ohio. So we have 36 hospitals that we represent directly, and these are our membership. Well, our membership for our region has patient revenues that are over $14 billion each year. We represent over 400,000 discharges, inpatient discharges that they go through our patient hospitals, and we staff over 9,000 beds for the region. So what we do for our membership, well, as you see, they have a very big impact in Northeast Ohio. Our direct membership, well, we have several programs that we work with our hospital members, and we bring solutions forward to them and the community together. And by that, I can tell you a little bit about each of our programs. For example, we have our community health program. One of the biggest deliverables for our community health program is the community health needs assessment. Well, that's something that's been going on before COVID, and it's changing a little bit how they're attacking community health needs assessment in the United States right now due to COVID, and see the pain points each community and where they need to target healthcare wise. And community health needs assessments look at a lot of things beyond just, oh, how many hospital beds do we need in this region? No, we're looking at specific communities, how they're impacted, and we're looking at giving legal aid for housing issues, for example. That's some of the programs in community health. So it's building beyond the immediate care, beyond acute care for our patients and for our residents. So our community health needs assessment also has a website, healthyneo.org, if everyone wants to look at it, where we actually track how our counties are doing, and we actually get specific data points, like such as ED rates for a specific population or by zip code, to be able to talk about how the health of our counties is doing. During COVID, and every time I mention this is our rockstar group, and I'm very appreciative of them, is our emergency preparedness. We run emergency preparedness for Northeast Ohio, and it goes through us. And the reason I say they're our rockstar group now is because they actually housed PPE in a warehouse. And when COVID first hit, that first impact, everyone had a shortage. I know we have masks and other PPE now at a higher rate. However, when everything first started, there was a real shortage in the area and in the nation. So our team members and our CEO, Brian Lane, who was going to speak today, they actually got in their cars, they went and they filled up over $1 million of PPE into vans, and they took it to member hospitals to distribute into the region. But emergency preparedness for us also ties in the city's responses in our Cuyahoga County, where we're situated, for all types of events. Cleveland had the Republican National Convention a couple of years ago. Well, guess who did the healthcare aspect of that emergency preparedness planning, and where that organization ran through us. So we convene a healthcare to prepare for big events like that. We also provide hospital finance and reimbursement to our member hospitals. This is primarily tracking CMS rules and the state and state government, like Medicaid rules, and their impact on the hospital community, and making sure the hospitals are compliant, one, and two, they know the changes that are coming forward, as well as different projects like the wage index, which is a project that happens nationwide to see CMS funding by different regions and how that's broken down. One of the projects I'm a little bit more passionate about is the Northeast Ohio Hospital Opioid Consortium. That's run through us, and it's a partnership between the Center for Health Affairs and several of our member hospitals and community partners for Northeast Ohio's response to the opioid epidemic. Because behind West Virginia, Ohio, I think, has the worst opioid numbers and rates in the nation. And this is something that's actually taken a back seat due to COVID, unfortunately. And we will see a lot more work in that background happening going forward, because that's an issue that Ohio is ravaged by. We feel it day in, day out. And unfortunately, COVID put that to the side, but it's something that's going to be there for us beyond COVID. And we need different members to come in and respond to that issue. And one of the big pain points for every response to the opioid epidemic is the different data points that everyone can bring in. You need law enforcement, you need healthcare, you need state, federal, local government brought in. So we're leading the charge in bringing all those community members together and building something as simple as a dashboard to let everyone, hey, these are your ED rates due to opioid overdoses, and be able to provide some care coordination and better response for something that's needed at a real time level, not something that you could do a month behind, because you want to impact the health of your community as soon as possible. And our final program that we provide as a hospital benefit is the Volume Statistics Program. And that's actually a program that that's how I joined the Center for Health Affairs. I also run that program. That gives me a full picture of the volume of the region at the inpatient level and the outpatient level. And that's a program that I provide monthly reporting to our members. It's a proprietary data for that one. So that's data that's not shared beyond the member hospitals. And it gives a full picture of what's happening in Northeast Ohio's healthcare community. As I mentioned, we also have Champs Group Purchasing and Champs Oncology. With Champs Group Purchasing, we look at the non-acute care hospitals, and we are providing over 17,000 members services. And one of the highlights I want to do COVID-wise for our supply chain specialists at Champs Group Purchasing, they were amazing at helping the little guys, the small rural hospitals or nursing facilities find PPE in those early months where there was such a shortage and it was such a difficulty for everyone to be able to respond. So this is taking us beyond hospitals. And in fact, James Group Purchasing, we could have any type of membership join, and we do have non-healthcare organizations become part of us as well. James Oncology is our oncology program where we partner with hospitals beyond Northeast Ohio. And in fact, it's over 10 different states in the United States. And we provide them better cancer registry data. We actually have cancer registrars on site at these hospitals that they actually extract their data and try to help oncology programs increase the quality of the care to enhance the quality of the patient care. And one of the things that we found with this is COVID has an impact on the types of care oncology patients are having. For example, there's been a big drop in rates of cancer patients for finding that first tumor, and diagnosis rates have dropped tremendously because of COVID impact. So you have to be able to tie in all these different pictures because unfortunately, that's not something that's going to wait for COVID to go away. So we have to look at solutions to help in this COVID world, look at our diagnosis rates and help get the community the care they need. And our final group within the Center for Health Affairs is the Essentials Group. This is a strategic opportunity and community relationship building group. This helps bring all of our community partners to the table together, and we could tie in different solutions together. And we'll talk about one of our solutions in a little bit. So before COVID, there's a slow and steady growth in technology, and the needs for healthcare data technology were actually at an inflection point before COVID. All COVID did was it accelerated that need, and it accelerated the intention, the work, and the attention we gave towards getting our solutions ready and usable, such as telehealth. For example, telehealth was something that was ongoing for years. However, due to COVID, the need for the telehealth visits spiked to historic levels. So rules by CMS were allowed for emergency rules that allowed telehealth to increase and allow doctors to see their patients that did not need to go in the office much easier and make it safer for the patient as well as the healthcare provider. And this spike in demand and for data was already happening at a rate that in healthcare, we're going to see in the next 10 years or so. They say the amount of data we produce will double every 12 hours for an organization. Now, that wealth of data, just if you have the data, doesn't mean you're making something meaningful with it. However, we're going to be producing all that. So we need to be able to synthesize and analyze all of our data points and make it actionable at all levels. So COVID really brought that to the forefront, and it helped accelerate our response to an ongoing issue. Hospital capacity in ICU beds is an issue that was huge and still ongoing because of COVID. And we were actually tracking that through our emergency preparedness for the region, for example. And that was a solution that would be a once a month update before COVID. And we would know all the different hospital types and the different bed types a hospital in the region had. And we would provide that reporting out and make sure that hospitals could communicate with each other. Well, because of COVID, we accelerated that data sharing, and as did all organizations in the healthcare community and beyond. Right now, the next need for data is going to be in the vaccine administration, as we want to try and get as many individuals vaccinated to help slow down the COVID pandemic. Another thing that we've seen grow, sudden growth is in the cyber attacks and the security threats for different hospitals across the nation. And there's been a real big impact with several hospitals being shut down for months on end because of the fact that COVID created an opportunity for hackers to target hospitals. So it's also about bringing a secure solution that doesn't allow a full hospital to stop in its track. And then imagine that when a hospital stops in its track, that whole community gets impacted because you can't send ED patients there. You can't have inpatient or outpatient patients there visit it anymore. So we also have to think about the full picture there, where we have to be operating in an ongoing basis and not have to stop and revamp every time a new issue comes up. So we need a scalable solution as well. At the Center for Health Affairs, in our 100+ years, we have a lot of experience convening different community members and bringing them together for different solutions. BCBS stands for Blue Cross Blue Shields. We actually took that model from Baylor, Texas, a long time ago, and we were one of the first organizations to work with the Blues and help start the Blues in their insurance. And right now, if anyone knows anything about Northeast Ohio, Medical Mutual came out of that collaboration. So we provided the collaboration for whole insurance company to start helping their region. We used to run hospital accounting as well, and that would be beyond Northeast Ohio, not just for our members as well. So today, our convening and our facilitating the communication and the rollout of solutions is happening through our programs such as emergency preparedness, where I talk about tracking our region's hospital beds and the different hospital bed types that are ready and allowing different hospital leaders to make decisions about the healthcare needs of the community, or a community health needs assessment, which we're running. And that's actually taking a different perspective now, because community health needs assessment, you actually have to go out in the community and you survey community members before COVID, and you have to find out the true needs of the community that go beyond healthcare, such as legal aid for rent or for housing or for food assistance. So we're actually working through different solutions to make that a little more virtual in the moment. Our Northeast Ohio Hospital Consortium is working at care coordination for our different members and providing the opportunity at real-time care coordination for opioid overdoses in our region and trying to fight that epidemic for Northeast Ohio. And one of the best things we do at the Center for Health Affairs is, well, as the hospital association, we already have that tie-in. However, I mentioned 90% of healthcare is beyond the hospital walls. So what we do is we bring in the hospitals, we bring in the public health officials, the EMS, law enforcement, universities, and different community organizations together at a table where we break down those silos of just the solutions that are already existing. And we allow the conversations to happen and look for a coordination of what can we do together as one. Because we're thinking as one community, because that's the best path forward. So as one community, we're looking at solving many different problems that were here before COVID and will be here after COVID, when COVID becomes just one of the many issues our society faces. Such as I've already mentioned, our social determinants of health, which are comprised of housing, transportation, and then we're looking at solving poverty problems for our community with our community health needs assessment, and maternal infant health. That's a big issue as well, that we're very invested in helping solve any bit of that issue as we can. And data and technology are the way forward and the solutions to bring everyone together and bring all of these community stakeholders into one table to build a common solution that helps fight several things at once. So as we bring our community partners together, COVID was the catalyst for this. And as COVID was a catalyst, we saw increased data sharing between organizations that would have never happened in any other climate because of the needs that COVID brought, such as modeling between different hospital members. Well, everyone has their own data scientists and they build their own models. However, you can get a better model of COVID impact for a region if you have data scientists cross-collaborate between different organizations. So we allow for that collaboration across different organizations and bring in the expertise from each silo and bring it all together. However, COVID is temporary, even though the time aspect of it, what is temporary is a short, long run. As an economist, while the short run and the long run has to do with perception. I mean, a couple of years does seem like it's a long run. However, a couple of years of our lifetime is a very short time period. So COVID will be here for a year or two in the aspect of being all-encompassing. But then when it becomes a daily problem we have to solve, this type of data sharing will have to move to organizations that do this on a daily basis, and everyone has to go and focus on their day-to-day business end. So this brings us to a permanent solution need. we need a solution that will go forward and will take COVID as the first solution, but however, be able to scale beyond COVID and help fight the different issues such as opioid epidemic that we fight in our communities, and break down these barriers and these silos and allow everyone to collaborate. So being a national convener in Northeast Ohio, well, we have brought in different community members, such as we work with community in Digital C here. Their work is to end internet connectivity issues in Northeast Ohio. Cleveland as an urban community is one of the worst areas for internet access for citizens and residents. So if our residents don't have internet access, what's the point of looking forward to and providing all these solutions, for example? So there are some basic needs that we have to take care of before we can actually get to our big solutions and be able to roll them out. So we're bringing community members beyond the hospitals together and looking at all the different issues to break down these barriers and these different issues that allow us to go forward. So as we eliminate these data silos at the community levels, we want to provide a 360-degree view of the community for all the partners together. So once you get the data in one place and you have everyone together, well, it's not as simple as I have the data to analyze now. There are real challenges in getting the data in the right format, getting it to the right people to analyze. Well, one of the easiest way to make actionable data is to make data visualization. Not everyone is an economist or a trained data scientist that would love to work with millions and millions of rows of data and do all types of regression analysis on it. For the rest of us, well, we want data in a fast-moving pace that we want to be able to read it and be able to tell, hey, this data is telling me this story of this is what's happening in my region. So data visualization is the best path forward to have our solutions reach as many stakeholders as possible. And the center has partnered with Transpara as our data visualization tool to help bring our community and data together. Our initial project with Transpara is going to be our COVID data analysis tool, but it's, as I said, it's only one of the spokes of the hub. It's only the first solution going forward. So the center and Transpara came together because we have a common vision of what a solution should encompass. We want to be able to have dynamic data analysis, be able to synthesize many different data feeds and provide a full picture of the community at once. And as we've seen with COVID, we need data on the fly. So we want to be able to have powerful data analysis with updates even at the second. And in healthcare, you have data feeds that go from the second to the monthly to the quarterly updates. So we want to be able to have our solutions to update with our data and be able to meet all of our needs at once. And as I said, we want a scalable solution that can grow beyond COVID and look at different needs, such as in the future, we want to build an opioid dashboard. And we're actually talking about the data to bring into our opioid dashboard, where we're going to bring in the universities, we're going to bring in the county, and we're going to bring in law enforcement to look at the solution and look at opioid overdoses at a real-time basis for our region. And the most powerful part of Transpara is it provides a conclusive insight to the data that tells you a real picture of what's going on in real time, and you can make action on a daily basis from your data feeds and all those different data sources you're bringing into one. And as we go forward into our virtual world, we want to be able to have strength of security at very high levels, and Transpara has this experience where they're used for nuclear power technology and refiner satellites. So security is on the forefront of their minds. So real quick, with our Transpara solution, we will be combining multiple live data sources and without migrating the data into one data warehouse. And this is very powerful because, especially with healthcare data, is proprietary, and who owns the specific data and how you house that data is a very big issue in being able to access it. And there's laws across HIPAA that make it hard to get that data within us in one place. So we don't have to migrate the data with Transpara. So that is a very powerful part of the tool that you have to be in the weeds to really get into. And as I said, we're going to have real-time alerts, and we can normalize this data as needed by per capita or by to compare our entities in our different regions, in our different geographies and what's going on, for example, Northeast Ohio, or build it up to full Ohio and see what's going on for the whole state. And KPIs make it easy for all types of analysts and different stakeholders to be able to read the data and be able to get some actionable insights from it. And one of the points that I have a personal pain point is I want a solution that is able to go on my phone. We're all using our phone on a daily basis. In fact, we all use our phone more than our laptops. And we want to be able to have a solution that anyone can access at any time, whether you're in a meeting or if you're in the car waiting at a stoplight and you want to be able to find that specific data point, you need something that's very versatile for you. So we found that with Transpara. So as we started with our COVID solution, I said it's only one of the spokes in our hub. So as we increase our connections between our community members, we're going to look at patient outcomes. We want to look at the financing of the city, bring in the energy of the city, and be able to have a tool that can analyze and provide real-time analysis of how the energy consumption of a whole city is going, and different solutions that bring in all facets of life in here. And because everything can be measured and you can get all the data points, however, you need a tool and a way of looking at it together that gives you actionable insights instead of just having the data lying there and not making any use of it. So thank you very much, everyone.
Thank you very much, Endrit. I'll ask you to stay on camera and stop sharing your presentation and ask all our panelists to come back on video here and we can start our panel discussion. We do have a couple of additional panelists that didn't present today, so I'd like to give them a couple of minutes to say a couple of words about themselves. And we have Robert Hylton and we have Ton Vries. Robert is with Transpara and Ton is with Bentley Systems. Robert, you care to say a couple of words about yourself before we get started?
Oh, probably less just about me. That's probably not as boring, but thanks, Larry, for having me, and thanks everybody, and thanks, Endrit. That was a great presentation. So, no, I would just add, I think all of this, not only COVID, but the whole smart city effort, can benefit so much from all the things we've seen today. So, just a great start. But I won't take any of the time from me. Thanks.
Thanks, Robert. Ton?
Yeah, thank you, Tim. So yeah, Ton Vries, Bentley Systems. I think we've seen a couple of great presentations, and especially what I think is especially important, the takeaways, is that it turns out that we can change quickly if necessary. That's definitely, and especially in the government space where change was always a long-term process. What COVID has learned is that adoption of technology can be a reasonably fast process also in the government space. And I think that's encouraging for everybody, not in the latest for the citizens of Helsinki, Jarmo, because you said it correctly, that's where you guys all do it for, right? For the well-being of the citizens, and whether it's in the hospital or the healthcare in Ohio, or living in cold Helsinki at this moment.
Thank you. Yeah, I think that's one of the different things about the Smart Cities track is we're actually talking about people and social welfare and the health of people and addressing, a lot of social issues. We're not just talking about technology here, but how technology applies to and it can actually help people. And I think one of the other things we have to deal with people too is that organizations tend to become kind of siloed, right? And we've discovered this in our research in smart city platforms. And building any one of these solutions, I think, you have to pull data together from different sources, and these different sources, aren't always amenable to, sharing data with other parts of the enterprise. So just to start off, and I would encourage people to enter questions into the Q&A field. We have a couple there that I'll get to, but please, feel free to enter more. But my first question is about these sort of silos that we have. How did you manage, and this is to no one in particular, please, answer in any order that you wish to jump in, but how did you manage to get these projects off the ground successfully and get these various functional silos, that you have in your organizations to work together, to implement a successful solution. Anybody care to comment on that?
Well, I can say something about the silos. So it's very common globally in the cities that city model stuff is in the city survey department. So the more surveys, but I'm very lucky and I'm very happy that Helsinki is so advanced in that way that we are in the strategy division, so in the mayor's office. So we cooperate with all the departments in the city, and yes, and our energy atlas is just one example of use case of the platform. So it can be whatever data, like atlas, and we can show whatever data we have and build the understanding on the city model of the situation. So this is the first stage. We have now under development the business recovery atlas about how the business is recovering, where are the free premises and usable spaces, and what's the economical power of people, and then what services they need. And so there's no technical problems anymore with doing that. It's the same concept we have on the energy, but whatever the topic is, we can now do it, and I think that's the point, and that's just breaking the silos. It's not any anymore. It's not only city planning or something like that, but it can be social changes and of course health care. And so thank you.
Thanks, Jarmo. Anybody else care to comment?
So on our end,
Oh, sorry. Go ahead.
Go ahead, Endrit.
So on our end, one of the things that we've noticed is in order to break that first down silo, someone has to take that first step, just to open the lines of communication. And as I mentioned, our different programs, like we are a hospital association. However, all of our programs look beyond the hospitals. They're looking at the community as a whole. And one of the examples I can give is our emergency preparedness group. During all of this, when they were working, they're at the forefront where they're working with the Cuyahoga County, Northeast Ohio. They're working with all the other counties, but that's the county we're directly situated in. They're working with the cities, the state. And then we were looking at the federal CMS rules and HHS and everything that was going on. And one of the things we did, we started tracking different rules and COVID testing early on for nursing homes, because the nursing homes needed extra help. And even though we're a hospital organization, we were working with that part of our community to help them set up their testing early on and be able to get employee testing and look for their patient healthcare and well-being.
Thanks, Endrit. Namrata, do you care to comment on this at all? I think your case is a little unique because you're using a TCS solution within, TCS to manage, I think you said 450,000 employees, pretty considerable number there. But any organization is going to have silos. So do you have any words of wisdom for our audience about how they can break down these silos and sort of get everybody to work together?
Yeah, so Larry, what we did was, as I said, we looked at agile as an approach and looked at incremental value. So once we established the purpose for accessing the data, it was far more easier to talk to the functions and get their approval, and then run it past the data privacy team, because data privacy regulations across countries are very different. And having gotten that buy-in, we knew, okay, we have figured out the silo. But to get that buy-in, what we actually went doing is create wireframes, create a visualization of how that data is going to get utilized, and then show it to the functional owners of that data. And then put it onto a technical backlog in an agile development, and then build it. So creating that train constantly on each and every data element that we wanted to look at helped us. And of course, we prioritize. So when I talked about a couple of priorities was, how do I understand where my employees are and what is their geocoded location? Or how do I get information about the COVID infection in those geocoded location, and then put it through my risk model. So that was the first thing that we started attacking. And this piece of information, neither the geocoded location of employees nor the COVID infection, both of them were available. So they were created new streams of data that we had to tap in. And then we looked at, okay, we do have the swipe records, but how do we process them? We do have the transport trips. How do we process them? So we went to those functions and said, this is what we want to do, and this is how the COVID contact tracing realizations would look, and would give us almost near real-time contact tracing. So then we brought them in. So I guess our success was to render a visualization and then go to the siloed departments and talk about it. This is how we're going to utilize the data, and this is how it would help the entire business.
Thanks, Namrata. And anyone
There-
else care to comment? Yeah, Robert,
Yeah.
I think I might have cut you off there. I'm
No,
sorry
it's
about
okay.
that.
No, not a problem. So we've done hundreds of these deployments that involve many data sources, and I would offer a few things that kind of help make this successful, and it all centers around starting small. So number one, starting small in the number of data sources you go after to start, and also small in that you're getting some of the lowest risk ones. And lastly, that you are partnering with those people and not moving that data. So Endrit said it quite well in his presentation. And one of the key differences here is you're not asking one of these silo owners to give you their data and you're going to move it into one of your systems and then they lose control of it. In our case, what we do is say, leave your data there wherever it makes sense, wherever that owner needs to stay in control of it, and you're reading it, you're accessing it, you're doing what you need to, but you're not consuming it and taking it away. So, and all these things that's starting small, that sort of proves the concept over time. It proves it to those silo owners. It proves it to everybody involved. And then over time, you can grow that to more and more sophisticated data, more and more quantity of data, more and more sources of data, maybe some of your more sensitive data over time.
Thanks, Robert. We do have a couple of questions from the audience. One of these is directed at Jarmo. Last week during the ARC forum, there were lots of questions about the value and business case for 3D because 3D models are so hard to keep updated, according to the questioner, for day-to-day operations. What additional value does 3D bring over GIS and 2D mapping information for your city? How do you make the business case for updating the data?
Yeah. Excellent questions. So we are very careful and very strict of that we don't do projects where 3D doesn't add value. So we must get added value from 3D to fulfill and make these projects. For example, you can't do wind analysis in 2D GIS. It's impossible. And if you want to do wind analysis, and if you want to do more microclimate analysis, say shadow and noise analysis and things like that, so you must have 3D model for that. So it's advanced. But certainly, yes, I always said, don't do it in 3D if you can do it in 2D GIS, because it's so much easier and you have perfect tools for that. But in certain careful steps you must do it. Yes, solar analysis, you can't do those on 2D on semantic surfaces. No, it's not possible because you don't have the roof angles and you don't have the shadow effects and things like that. So carefully choose the things where you get real added value from 3D and concentrate on those. Yes, and maintenance is a big thing, and it must be taken care in the beginning. If you don't, and you have 3-4 years old 3D model, it is not useful anymore, because the new things are the most important and most interesting for people. You must have the new things also there.
Thank you. We have another question directed at you, Jarmo, but I think this applies to everybody on the panel, really, and that is, how did your city model help this past year with the pandemic? And I would ask this to everybody, if you could give us some examples of how these technology solutions that you've implemented have helped you make better decisions, and if you can talk about any of the results of those decisions. You know, some of the long-term benefits. Obviously, the social benefits are very important, or you know, environmental benefits, or you know, even economic benefits that came out of these solutions. Would you care to comment on that in the context of this pandemic that we have right now?
So who do you want to start?
I can add a little bit of just what's happened on our side, even though I'm not one of the speakers, but Larry, if it helps, back in I think it was January or February, there was the Johns Hopkins site showing some COVID-19 data and other things, and some of us at Transpara kind of got together and you know, it was very interesting. We were looking at it just as an example of something, and then found a bunch of things that just weren't helpful in there. No per capita data, no way to compare geographies that don't look the same, no ability to do some things that actually give the data real meaning. And also, as the pandemic grew, you know, it used to be just a big map with red circles on it, and now it looks like somebody threw up on that map essentially, because it's just filled with red. So it's kind of lost all of its meaning. And so what we did was say, what do we actually care about? You know, I want to know if, you know, the county of San Francisco that I live in is doing better than the entire continent of Australasia or the entire state of New York or anything, any geography. And they're very hard to compare because they're very different sizes, very different characteristics. So selfishly, we just went ahead and made this initial COVID-19 tracker just for ourselves, just because we had the product already and it was just something interesting to us. And this was before even the heavy lockdown. And now it's turned out to have been used in a lot of places all over the world by people we weren't even expecting. So, you know, the government of Australia is using it on a regular basis. We just did it for free and just kind of let it sit out there and didn't really even promote it very much. And now it's like, I think 40 plus countries now using this data, which is really the same data you'd see in any tracker, but now just looked at from a whole bunch of different angles just because we could. So I think you're seeing a lot of different benefits, and we're getting a lot of feedback from people all over that they've been using it for certain things, and a lot of people we've never heard of. So I think it's spread and just augmented the usefulness of the data, of the same data. So I think there's just you know, that's the only point I would make, is it's helped give context on top of what was good data, making it a bit more into great data.
Yeah, I think data is one thing, but that context is very important. That's what allows you to make those intelligent decisions. That's really the value of these smart city platforms and other technologies that we're talking about here today. Anybody else care to comment on that question about you know, the value that you've experienced during COVID or even after COVID? Because I mean, we're talking about COVID today, but I think as somebody mentioned in a presentation, you know, this will not be with us forever. So we're kind of scrambling to implement these solutions, but these solutions presumably have long-term value past the age of COVID. Maybe we could talk a little bit about that as well.
Yeah, if I may.
Please go ahead, Jarmo.
Yeah, sure. So, yeah, so
it's Todd, sorry.
Yeah, no, that's okay. So quite often we look at, you know, the immediate effect on COVID mitigation and so forth. What we should not forget is that the technology, underlying technology, is quite often used within cities, but also in the ecosystem that support the cities, whether it's engineering companies, construction companies, and so forth, to continue the development of cities and to continue the development of our full infrastructure, right? And the underlying cloud-based solutions, digital twins of new projects, of existing infrastructure, have helped these organizations to move to not only cities, but also, as I said, engineering firms, to move to a more virtual environment. So the total impact on the livability of the cities, I would say had a minimal impact because of all of the lockdown, right? And I think Jarmo hopefully can commit or can confirm that. But what I saw in his presentation, how they share on the web their new developments, their interaction with the citizens around their whole infrastructure developments and their business, basically helps them economically because developments continue, but also socially because it keeps the public engaged in the process that the city and the city government actually is managing at that moment. So it goes beyond direct impact on COVID measurements, but also in keeping the society going, right? Keeping our lives going.
Exactly. Right. Good point. Anyone else care to comment? We're kind of running out of time here, but if anybody else wants to comment on this question, I'd appreciate it.
Few small points. Yes. So we didn't get the match with the 3D models and COVID situation. So no added value. So we didn't do it in that way. But of course, there are some things. Let's say urban green areas, the importance of the urban green in this lockdown situations. So it's very important for people they can reach green areas and what's the quality of the green areas. And so there we can have a match. And then, of course, we are concentrating on the recovery of this situation. So how to support new business things. And of course, there hasn't been city events for 1 year, and I think this year is the second year. And after that we can arrange city events. There's a huge demand for city events, and if we can make a portal somehow, you can design a city event on a virtual environment and then bring it to the real world, so it can support and it makes it so much easier. And these things are these we can really do, and they help for the recovery.
Thanks, Jarmo. I think we are at the end. I'd love to go on with this, and we do have a lot more questions. We simply don't have time because we have to, get things turned around for the next session. So I want to thank you, thank all of our excellent presenters that joined us from all over the world today. We appreciate you taking the time and the effort to help us out here in our forum. I think these were excellent presentations and an excellent discussion. We did have a couple of questions that we could not get to. I will post those to the chat area of vFairs that we have for our forum. So if you go to the main vFairs forum page under networking, you'll see various chat channels, and we'll be talking about smart cities and posting some of the questions from these sessions that we couldn't get to in there. So feel free to continue the discussion there. But once again, thanks everybody for participating today. I thought it was excellent content. Hope to have you back all next year when we are in real life, hopefully, down in Orlando. So once again, thank you, and we hope to see you in the next session.
Thank you, Larry.
Bye, everybody.
Bye.
Thank you.